Great. All right, I'm gonna get going then. Apologies for the late start, everyone. We just got out of another meeting that ran a little bit long. But today is, I guess I should say, my name is James Pepper, Chair of the Cannabis Control Board in Vermont. Today is November 20th, 2024. It's 1:09 p.m. and I call this meeting to order. Just want to make a few quick changes to the agenda. We're going to add a deliberative session right after the agenda item about incomplete retail applications. We'd like to review some of the facts and circumstances surrounding some of the ones that did not make it across the finish line. I think Commissioner Hallberg is going to recuse herself from one of those discussions. And then I'd also like to add a review of the medical report, the Act 166, Section 11A report. I'm going to add that agenda item right before adjournment, after we've done everything else. Any other changes to the agenda?
Nope, let's rock and roll.
All right. Wanted to give a staffing update. Very excited to announce that we've hired longtime compliance agent and current interim director as our new permanent compliance director, Mike DiTomaso. I doubt this decision will come as a shock to anyone. By all accounts, Mike has done a phenomenal job leading the team over the past 4 months. I have seen market improvements to turnaround times, more consistency in decision making. Mike also helped to restructure the team in a way that will not only further improve our efficiency, but he's also been really great at identifying issues and finding solutions to those collaboratively. So from where I sit, it's been such a pleasure watching Mike step up to this role and really thrive. I know I'm a broken record on this point, but the scope of this work is so broad. It touches on required agricultural practices, pesticide enforcement, good manufacturing practices, food safety, additives, and about half a dozen other regulatory overlays that in any other industry would be supported by other agencies to enforce. But in this industry, it falls almost entirely to compliance. Mike and the whole compliance team is just so dedicated and dynamic. So couldn't be happier that Mike's willing to take on this role. It also means that Mike's position is now open and I think has been posted.
Not yet. This coming soon this week.
It'll be imminently posted. So if anyone listening is interested in applying for a job here at the CCB, check out the Department of Human Resources, DHR website for the career portal. Just another quick reminder about rulemaking, that we are about to engage in the formal rulemaking process. That's going to include both technical amendments, but also some real substantive changes, including some of the parameters that govern the medical use endorsement, new citing retail requirements, tier expansion and relegation, and the licensing renewal process, to name a few. As it stands now, I think we're on track to get on the December agenda for the Interagency Committee on Administrative Rules. If we don't see any delays, that means we should have our rules promulgated sometime in the late spring. I want to once again ask everyone to take some time to look through those proposed changes once they've been published and let us know what you think. We have a lot of competing interests and we try and thread a fine line between those, but it's difficult to know how well or how poorly we're doing unless we hear from all sides, all interested parties. And of course we can fix things while the rulemaking process is open. Once the rules have been adopted, we just have to wait. We all have to live with them until us or some future board decides to reopen them. But I think that we'll probably have a better sense of the timeline for everyone that we can provide at our next December meeting, next regular board meeting. Other than that, we just need to approve the minutes from our last meeting that was on October 30th. I noticed that Patrick has also done the minutes for our medical meeting that was on that same day, as well as the outdoor siting meeting, the Act 166, Section 18. It was on October 31st. And then the two special meetings that we did to hear from the responsive bidders, and then the evidentiary hearing on November 13th. So thank you, Patrick.
Thank you.
Is there a motion to approve those?
So moved.
Seconded.
On favor?
Aye.
Aye.
Aye. All right. Let's see what's going on the agenda for today. Public comment. We'd like to hear your comments. We'll handle this the same way we always do. If you join by the video and would like to comment, please raise your virtual hand. We'll do our best to call on you in the order that you raise your hand, and then we'll move to people that join by a phone. All right, and if you join by a phone, you can, Tito?
Hey, everybody, can you hear me okay?
Yep.
So I just wanted to comment on integration, and specifically, how can we be expected to keep integration on when the CCB? It feels cruel to make us close due to a technical CCB issue. So, what is the way to proceed and stay open and make sales? And secondly, it definitely feels like the ID cards should be every 2 years, like the background checks are. It's really expensive to do every year and just feels unnecessary. Thank you all for listening. Hope you're having a great day.
I tend to agree with that second point. Yeah. All right. Anyone else who joined via video? And if you joined by a phone and would like to make a public comment, you can hit *6 to unmute your phone.
Do have some folks in the room. I don't know if anybody has a public comment. No?
You have one of the businesses that we work with had a question with the upcoming holiday about gift cards. Has that been decided, and would you could comment on some of that discussion? I'd love to hear more.
Sure. We generally don't take questions during the public comment period, or we don't respond to questions during the public comment period. This very quickly turns into a Q&A session when we do, but happy to follow up with you after the meeting. All right, I'm going to close the public comment window. We got a lot to get through today. First substantive item on the agenda is a discussion and possible vote about reopening cultivation application windows pursuant to Rule 1.10. So, of course, we wrote into our rules that we would open cultivation tiers 1 and 2 for no less than 30 days, sometime before February each year. And so, considering 2s at the very minimum are closed, we should vote to kind of honor that portion of our rules. But any discussion you want to have about that before we kind of think through what a motion might look like?
We're talking about just opening tier 1 outdoor and mixed.
Yeah.
Right.
And tier 2.
And tier 2.
Sorry, tier 2, yes, tier 1 and tier 2. And would we be leaving it open for an extended, we would just be leaving it open for 30 days,
30
right?
days, yeah. And to follow up on a discussion that we had back in September, I think at that point, I'd like to see the cultivation windows closed for all tiers for a limited time while we reassess, with some of our consultants, reassess the size of this market, reassess kind of what certain scenario might play out, and think about how much more cultivation we need, how much more cultivation would be healthy for this market. And, I think that, we should take the time to do that. When you look at the actual original legislation, the legislature actually only intended these windows to be open for 30 days and then give us the discretion to open and close them at our kind of, as we evaluate the market. I think we haven't done that really significantly for the kind of last year and a half. So
Are we considering closing, like would we vote on closing tier one today, or do we want to hear more about like how many are in the queue, how many people we have in pre-qual like we have with some of the other tiers, or do we think?
You know, given that we're talking about something that's, you know, I think the motion that I'm contemplating is we open on January 1st,
Mhm.
close on January 31st. And I think we'll have time in the interim to hear. I mean, if you remember, we got through every tier two in a 30-day window. Or when I say we, licensing got
The
through
royal we.
Yeah. So I think we can reassess when that kind of application submission closes versus when we close on kind of contemplating whoever's in the pipeline.
Yeah.
I think the vote today should just be about closing on a date certain.
Yeah, and then just to put a finer point on things, as folks might recall from even the retail conversation a couple months ago, I view something like this as temporary. I think we would, if we did something like this, you know, we constantly want to provide opportunity for folks to get into this market. And I think this market is unique because the barriers are, you know, some folks have challenges with the barriers to entry here, but they're a lot lower than most other places. And I think we take great pride in that. But there's so many factors that I think we need to reassess in terms of total canopy usage, who's using what part of their license or how much square foot of their license right now. We need to kind of get a better hold on where this market is to kind of make sure that if we continue to continuously license, we don't push everybody over a cliff that nobody wants to venture down in terms of how much supply is out there. So I think I would be supportive of that kind of temporary pause while we, you know, we're close to having some consultants in place to kind of help us do that analysis and help us make more, you know, more informed decisions about what's the best path forward for new cultivation licenses moving forward, whether it's tier one or higher than that, quite frankly.
I think it's a lot easier to look at the market when we've got a pause happening. So I completely agree. I do think, I mean, I think we're always concerned when we close a tier that there'll be a rush of applications. And we haven't really seen that. I mean, we've sort of seen it with retail, but I think with tier one, we will probably see that because it's the lowest barrier to entry. So I think we just want to be really clear, and maybe in our December meeting, we can go over again what makes a complete versus incomplete application. So it's really clear when we come to the closing point, like what will get someone across the finish line and what won't.
Yeah. Well, I'm not tied to January 1st, or maybe because that's a federal holiday, like January 2nd. But I'm not necessarily tied to that date if we want a longer runway to establish that clarity. But I think honestly, like,
I think that timeline makes sense for a couple reasons. One, we should have a consultant in place to help us by then. Two, that still gives us enough time after that window has closed to kind of think through things and talk with the legislature if we need to about the kind of health of the market.
Yeah. All right. Well, do we want to workshop a motion, or is there one ready for us?
Well, I have written one, and
Okay.
you're welcome to make friendly amendments if
Okay.
you like. I move that the board notice the opening of tier one and tier two outdoor and mixed cultivations licenses to open January 2nd and to close on January 31st, 2025.
The friendly amendment that I would say is I think we need to include tier two indoor. I think the rule says 1.10
Okay,
says all indoor and outdoor
All-
tiers 1 and 2.
okay.
I know someone will text me if I don't make you do this. You have to vote on the friendly amendment.
Is there a motion to approve the friendly amendment?
So moved.
Seconded.
All in favor?
Aye.
Aye.
Do I have to repeat the motion?
No.
Okay,
We still got to vote on the motion.
correct.
Yeah. Is there a second to the amended motion?
Second.
All in favor?
Aye.
Aye. Okay.
Thank you.
All right. Is that all we need on that agenda item?
Unless you wanted to move to close the
Oh,
other,
yes.
if you want to do the second part of that now or in
Yes.
December.
Sure.
Okay.
Do you have a motion for that?
I move that the board notice the closing of all cultivation tiers effective January 31st, 2025.
Is there a second?
Second.
All in favor?
Aye.
Aye. Okay. Next is we need to adopt our regular meeting schedule for the new year. I've got a list here of the dates. We'll publish them and get them kind of up on our calendar as soon as they're approved. But we're sticking with the last Wednesday at 1 o'clock, last Wednesday of the month at 1 o'clock, unless there's some sort of conflict. But it looks like by these dates, there's not. So that would be January 29th, February 26th, March 26th, April 30th, May 28th, and June 25th, all at 1 o'clock. So is there a motion to approve that regular meeting schedule?
So moved.
Seconded.
All in favor?
Aye.
Aye. Okay. Next on the agenda is the discussion of the incomplete retail applications. Olga, did you want to help walk us through kind of where things landed in October and then earlier in November, the two kind of cutoff dates?
Yes. Okay, as of October 25th, we had 20 retail applicants who finalized submissions on time. These applications were at varying stages of application completeness, with some further along than others. A few of those applications were submitted on or days before the October 25th deadline. Applicants, as we all know, were afforded until November 15th to resolve any outstanding deficiencies in their applications. And based on the information from our licensing division, here is a breakdown. 10 out of 20 retail applicants have successfully met the November 15th deadline. These 10 applications have been deemed administratively complete, including a passing site visit by our field agents. These 10 applications are up for the board's review today and will be further addressed in the executive director report later this meeting. And then 10 additional applicants have been deemed incomplete. As of November 15th, the detailed list of those applications has been shared with the board already. Unmet requirements differ for each applicant, but the common factor is that they were unable to demonstrate fitness for licensure by November 15th deadline. And so in line with the board's request, I have provided application materials that were submitted by these establishments to you. And at this point, the board may choose to act on these applications as submitted or deliberate on them in a closed session.
And if obviously fundamental fairness requires notice. Other than the 30 days notice that we voted on and sent out to folks, if I recall, anyone who is in the queue has been contacted multiple times by us, via phone, via email.
Yes,
Compliance has been, in many cases, to their sites
several times.
several times.
Yes, and you'll see in the executive director report later the number of retail site visits that our compliance team has done. There have been at least one retail site visit a day last month.
Yeah.
So the focus has been on these applicants.
Okay.
And same from the licensing division, multiple emails and phone calls, including within a day or two of the deadline. So we have been definitely making it very clear that the deadline was November 15th, and every outstanding requirement was spelled out in writing as well.
Great. Okay. Well, I think just in fairness to the applicants, we should go into a deliberative session to talk about the very specifics of each and decide if there's any reason to extend that deadline for any of them. So
Just as a point of order, perhaps, do we want to discuss the other items that we have to discuss in executive session at the same time? Can we do
In
that?
the deliberative session, you're obligated to stick to deliberating on the contested cases. With the kind of rights of individual stuff, but
Okay. So we would have to come out and go back in.
if there were any discussion of policy related stuff.
okay. Do you have a motion for us?
I move that the CCB go into deliberative session for the purpose of discussing the appropriate resolution related to retail applications. That's it.
Okay. Is there a second?
I second.
All in favor?
Aye.
Aye.
Aye. So I'm gonna, we've been provided information, so we're not just having to start from scratch here. I'm gonna try and stick with the schedule, which gives us 20 minutes. Patrick, would you mind putting up our away message, and we will turn off our camera.
So the bad news is we have to kick you out. The good news is there's a really nice.
All right. It looks like we're still recording. Can you hear me, Patrick?
Yes, we're all set. Go ahead.
Okay, so just as a time check, apologies to everyone who sat through all that. James Pepper, Cannabis Control Board. It's Wednesday, November 20th, 2024. It is now 2:27 p.m. We just came out of deliberative session. I think the consensus was that one of the 10 that we were looking at actually was in fact administratively complete on time. The other 9 are not. I think the one will be moved to our staff recommendations and voted on at that point. The other 9 will, our licensing team will be in touch with each of you individually to kind of explain what the next steps for you, what the various options are for you. So hang out for that. And with that, I think we're moving to Executive Director report.
Hopefully. See, I probably should undo it again. Should I start this first? All right. All right, here we go. So it's our report for November 20th of this year, 2024, and I'll dive right in. Okay. Let's see here. As always, we'll start with our current active licensees. You're looking at a snapshot of all active licenses. Going back 3 months, as sort of a quick refresher, in October, we had 576 active licenses. We are now at 583, showing a gain of 7 for the month of November. And the data is through November 15th. And that data is in green. As you could probably tell, and also as in prior months, we primarily see small gains across our cultivator, manufacturer, and retailer licenses, with a small jump to 387 for our cultivators, and a little more substantial jump for our retailers from 89 to 94. Numbers do remain relatively stable, though, months over months. Now, keep on moving. And now we'll look at a couple of our priority status slides. So here we're looking at active licensees and their status as of November 15. Again, numbers are steady months over months in terms of the percent allocations between these 3 groups. And I got one other slide here. So here, again, you could see the changes are pretty proportional months over months in terms of our different priority statuses. We are showing a small overall decrease in the social equity group and also in the economic empowerment group. I did check in with our licensing team, and there were a couple voluntarily relinquishments from a tier 1 outdoor cultivator, social equity, and a tier 2 manufacturer in the last months. So that's what you're looking at here in terms of some changes. And in terms of economic empowerment, we had a retailer and also a tier 1 outdoor cultivator who is economic empowerment licensee who chose not to renew in November. So that's a quick update here. And I'll move on.
So here we'll look closer at the cultivators. I have also 2 slides for you. So the latest data on all active cultivator licenses here is broken down by their type and tier. Again, 3 months worth of data. November is depicted in green. Pretty stable in terms of the changes months over months. We are primarily seeing increase in tier 1 indoor and tier 2 indoor, and some decreases in our tier 1 outdoor category. So that remains to be a trend months over months. Okay.
Yeah, thank you.
Good. And then as a different look at the same data, sort of, percentage wise, if you look at it, we're seeing an increase in our indoor licensee totals, which is now about 39%. And our outdoor group is about 35%, and mixed license type is staying at around 25%. If we were to turn these numbers into percentages. So that's the roundup of our cultivators. And now move on to the manufacturers. A quick look here. Again, 3 months worth of data. November data is in the last block. 88 active manufacturing licenses. We have a gain of 1 in the tier 3 manufacturing category, months over months. That's the manufacturers. And now moving on to the standard slide, licensed canopy capacity square footage data. Indoor canopy data is in light green, and outdoor is the darker color. So numbers track here. You are seeing a steady increase in the indoor licensed canopy months over months, and the outdoor capacity is decreasing slightly as well by 9,000 square feet in October, an additional 3,500 in November. The total amount of licensed canopy is up slightly. Right. And here a quick look at the capacity versus utilization. The rate is the same as it was last month. For indoor is 51%, and for outdoor is 77%. So I think we might have had 76% last month, but about the same. Numbers are tracking. Okay, so that's this slide, and on to the retail location slides and areas of density. Again, I have 2 slides here, which is an overview of all licensed retailers and retail applications in the queue. 97 total, if we include 3 integrated, is the number of retailers that we have right now. As expected, November has been busy for our licensing division in terms of processing retail applications. And as we discussed earlier, we have 10 pending board approval and 10 additional in a queue as of the beginning of this meeting. So here's slide number 1, and now the alphabetical, and here's our second slide. Again, all of our retail locations are here. So that's the licensing data, and now I'm going to move on to the compliance data next. I have a few slides here for you. Again, data is at November 15th here. So first, a quick summary of the agency's compliance, inspections, and investigation work. We are reporting 60 inspections and 9 new investigations. Majority of inspections involve retailers, understandably. In terms of the investigations, we are holding pretty steady with 9 for the months, down slightly from October, where we had 10 new investigations open. So that's month of November. And now a little more context here. We'll look at 3 months worth of data and we'll just focus on the inspections. So again, as I mentioned, retail inspections were the team's focus over the last months. There's 31 reported. Again, it's in green. The data is in green for November. We also had 20 cultivation site inspections and 9 manufacturers had a visit from one of our compliance agents as well. So that's the breakdown of the inspections. And now we'll look at the investigations. 9 new investigations were assigned in November, 2 in cultivation, 5 in retail, and 2 in manufacturing. For some additional context, so the investigation numbers represent formally assigned investigations that are expected to result in a report or a memorandum of findings. Most complaints do not escalate to this level and are often resolved by our compliance and enforcement team through clarifying phone calls or by sharing educational materials with the licensee or by conducting limited investigative work from the office. The investigations that make this list are those requiring a more formal approach, including witness interviews, product sampling, or requests for additional documentation. So 9 of those were reported. And now we'll look at the chart that provides an insight into the specific actions of our compliance team. Again, 3 months worth of data. November again is green. So we're looking at 21 reported complaints, 14 formal letters of warning, 5 notices of violations, 3 cessations of operation. Again, we continue to see letters of warning being utilized by our team quite a bit to address most of the received complaints, as you can see here.
It might be nice if there is a trend in what those letters of warning are about. In a future meeting, it'd be nice to know if there's a trend. Those are all about thing or similar thing.
Yes, we could most certainly pull that. I do have a slide that breaks down that information. We have a great team. Yes, we're trying to keep an eye on those. Yes, so
thank you.
yes, so again, these letters tend to address violations that rise to the level of a formal notice of violation, and it's assessed by our Director of Compliance and Enforcement. And yes, the most common issues this month are represented here with inventory compliance issues leading the way.
Informative from trainings or networking events or guidance or even rule updates and so on and so forth.
Yes, it's worth thinking about that some of these reflect the target areas for enforcement priorities coming from here rather than coming into here too. So it's
Yep. Okay. So that is the breakdown here. And then we good to keep going? Okay. And there is a breakdown of the specific types of complaints that we've received and processed. Again, 21 total, and top category being business operations issues, followed by advertising.
And I just want to make, so there were, I think, 4 advertising notices of violation, but the complaint and the number of violations aren't necessarily, they don't necessarily correlate, right?
Correct. And it is also possible that the letters of warning that went out were stemming from the October data or investigative work done. So, yeah. Okay, so that's the last slide for the compliance. And we'll take now a quick look at the medical program data. One slide here, numbers are keeping steady. If you look at the last 6 months at least, but that's a year worth of data here. All right, that is a wrap for the data, and we are on to the staff recommendations for licensure. As always, we'll begin with listing staff recommendations for initial licenses, and then we'll represent the list of license renewals and late renewals as appropriate. So first, I have 2 slides here. Those are recommendations for initial licensure. I think a total of 15 this month. So that's the first slide. And one more slide here. That's the second slide.
Great. Great work, everyone, getting those retailers done.
Yeah,
Thank you.
that is
They're
our,
complete.
yes. So that's the list. And then onto the conventional license renewals, we have 2 slides for you here.
Anyone who's joined by phone, this will be posted on our website by the end of the day.
The second slide of renewals.
Okay.
Good. So next, I have a list of late renewal applications for you. Short list this month. We have 4 under the rule 1.15.1D. All of these businesses have supplied all of the required documentation and have also provided letters explaining the late filings. Staff recommends that the board accept and approve these late renewals. I wasn't sure if we wanted to stage the motions though, so I kind of went straight.
No, I think it's fine. I mean,
It's fine to keep.
Are any of these subject to contingencies or any?
No, those were complete, they're complete, just late.
Just thinking it might make it easier to separate it if so, because then the motions get more complicated.
Yeah, we do. My next slide includes some late applicants that may require contingencies.
Maybe we should pause and
Yeah.
vote no.
let me just consult with my legal counsel. If I said this for all of them, so that would be fine, right? Would only apply if there are actual contingencies. Yeah, okay.
Okay.
All right.
So
So
these are the recommended approvals,
yes,
and there's
there are no contingencies that the staff recommends.
want to approve these now.
I have a motion that will cover, I think, all of it.
Okay.
If we've got some that are recommended to approve but have contingencies to go along.
So I will
You had
keep
outsmarted me.
going to the next slide with contingencies. Okay. All right. So the following establishments have filed explanations for their untimely filings, but the elements required for renewals are still missing. The applications, materials, and explanations have been shared with the board ahead of this meeting. Since some renewal elements are missing, the board cannot approve these renewal applications at this meeting. The board has discretion to accept the incomplete applications and continue the existing licenses for a short period to allow the renewal process to be completed. For these applicants, the board should determine whether the late filing should be accepted, and if so, how long to continue the existing license. Staff recommends that the board accepts the late filings and continue the existing licenses in force until the board's next meeting on December 18th. So
Yeah, it's good to me.
Okay.
You ready for a motion on that, or there's there?
yes, that was the last slide on staff recommendations.
All right, Julie, let's see this unified motion.
I move that the board adopt staff recommendations to approve the applications listed, issuance subject to final payment of required fees and any other contingencies.
All right,
That was concise. And I second.
all in favor?
Aye.
Aye.
I think there's one other item on the agenda, and that is a presumptive disqualification item. It's an application for an employee ID card that involves a presumptively disqualifying conviction. Since this typically involves personal information about the applicant, the board may act now, or if warranted, can take this under deliberation.
Has everyone had a chance to review the memo?
Let me just call, we've had so many conversations today. Let me just call it up so I can remind myself. Yep.
Does anyone want to talk about it in a deliberative session?
I believe I need to.
I don't think so.
Okay. Is there a motion to approve this employee ID card?
I move to approve the employee ID card and the information presented to us in this meeting.
I will second.
Any last discussion about this?
Not for me.
All right, all in favor?
Aye.
Aye.
Right.
Okay, Olga, if you recall, I amended the agenda one last time to review the medical report, but I will release anyone who wants to from having to sit through that.
Yes, very kind of you.
Thank you.
Put it up. It's a PDF, so I will just do that. Okay, I think we all remember that the legislature in Act 166 asked us to report on improvements to the medical program, specifically to work in consultation with the Department of Health, the Medical Society, the Green Mountain Patients Alliance, the Cannabis Retailers Association of Vermont, to develop recommendations regarding improvements to the process of evaluating and approving new qualifying conditions, improvements to how the use of cannabis is communicated to patients and patient providers, and appropriate regulations regarding electronic or battery-powered devices that contain or are designed to deliver cannabis into the body through the inhalation of vapor. And that was due to the 2 committees of jurisdiction over the medical program by November 15th. And we did submit this on time. You know, as usual, I like to kind of orient the legislature to the evolution of medical cannabis in the state. This is the day we legalize, the authorization to create brick and mortar medical dispensaries, the year that we decriminalized possession up to an ounce. And then this is the date where those civil penalties which remained on possession and cultivation go away. So cannabis, home cultivation and possession become fully legal. 2020, the board creates the CCB and authorizes tax and regulate. 2022, we assumed control over the medical registry. We also later that year opened our first retail establishment. And then Act 66 created a medical use endorsement for adult use retailers, and then required a report on future improvements to the program. This slide just shows the evolution and decline of the patient registry, and a similar trend, but much smaller, less dramatic on the caregivers. These are the dispensary locations. I mean, I guess I should go back here. 2018, you can see the high point of this corresponds to when cannabis was still at least a civil violation. Once we legalized, this decline started. This is a very similar trend in almost every other state. And then, right when tax and regulate comes, it accelerates that decline. And it also happened to accelerate the decline of the existing medical dispensaries around the state, which, of course, the legislature wanted to avoid. When they created Act 64, when they created the board and tax and regulate, they acknowledged the importance of the medical cannabis program and said that it's their intent of the General Assembly that dispensaries continue to provide the unique goods and services to registered patients for therapeutic purposes. Of course, if there are no locations for them to provide those services, then they won't be offered. I get asked by the legislature quite a bit, why do we even need a medical program anymore? Can't patients just shop at adult use retailers? And I always have to kind of orient them to some of the benefits of the medical program. There's still a stigma to using cannabis. And so privacy and confidentiality of the consumer is important. There are specialty products that are prohibited in adult use stores, mostly the high potency products, but also, medical dispensaries can create custom formulations, and they're allowed to, have products approved by the CCB. Access to specialty services, private consultation and education, reservations, delivery, curbside pickup, and access to caregivers. Also, minors are allowed to access cannabis through once they're on the registry. There's increased possession and home cultivation allowances, and of course, tax-free purchases of cannabis. Act 166, kind of recognizing this decline in patients and closure of medical dispensaries, created a medical use endorsement, which would allow adult use retailers that meet certain criteria, enhanced criteria, to serve patients and allow for tax-free purchases to registered patients. This is the enhanced criteria, protection for patient privacy and confidential records, enhanced training and educational requirements, segregation of cannabis products that are otherwise prohibited in adult use stores, and enhanced record keeping. They're authorized to do delivery, access for patients under 21 years and old, and whatever health and safety requirements. So this is a rulemaking authority. I will say that I've put pen to paper and have created regulations for each of these that will be published when we publish all of our rules, hopefully in December. So moving from the introduction to the recommendations, recommendation 1 was about improving patient and provider education. So what's the problem? The problem is, registered patients generally have complex medical histories. I just listed all of the conditions that would qualify a person for the medical cannabis registry, and you can see there's some pretty serious conditions here that inevitably will lead to people having, multiple prescription drugs or kind of interactions with multiple specialists. The kind of compounding aspect of this problem is that many physicians and pharmacists are uncomfortable discussing cannabis use. This is a Schedule I controlled substance, the definition of which is that there are no accepted medical uses for cannabis. And so where does that leave patients? Well, this is from a patient survey, satisfaction survey that we released last year, or that we conducted last year, 2023. You can see that 659 people answered this question about where they get their information about cannabis use. The vast majority of people are using self-guided research, the internet, or the bud tender at the dispensary in order to kind of inform their decisions. So the recommendation here is to consult with Canify and develop an evidence-based cannabis education curriculum and mandatory educational requirements for any employee at one of these adult use, medical use endorsed adult use retailers regarding the physiological effects of cannabinoids, appropriate dosing protocols, modes of administration, potential drug-to-drug interactions, risks and common side effects of cannabis, and then the types of information that bud tenders can and cannot be giving to patients. A secondary, kind of a more longer term, potentially us or maybe just independent of us, is finding ways to help educate healthcare professionals who inevitably are being asked questions about cannabinoids and do not feel comfortable making these kinds of medical recommendations. Recommendation 2, modify the process for evaluating and improving new qualifying conditions. The problem here is, as I mentioned, the Schedule I status really limits the research opportunities that would be necessary for adopting things like on-label uses for cannabis. Scientific reports that purport both positive and negative effects of cannabis are often complicated to understand or evaluate for quality and bias. And then, the legislature often lacks the time and resources necessary to effectively weigh the benefits and detriments of adding new qualifying conditions. I think we've only seen one added in the past 5-7 years, I think.
In the time that we've been here, just
Certainly there, yeah. But I think even before that, I think PTSD was added in 2017, I think. And it's the fact that, the legislature just doesn't know when they're presented with all this information, what's real and what's not. So the recommendation here would be to either authorize a healthcare professional with a specialized cannabis medical education to be able to recommend patients in their care on a case-by-case basis for the registry, or authorize a non-legislative entity to evaluate or recommend or approve new qualifying conditions. Here I just gave some background information for the legislature about all of the medical use states, which I think we're up to 41, that do not use the legislature when it comes to the decision around qualifying conditions. They have a third party that evaluates, and either through rulemaking or through recommendations to the legislature can adopt new qualifying conditions to evaluate and adopt. The vast majority of them are the Department of Health. Some use a board of physicians. Some kind of create their own board. That's true in Utah, that involves patients, caregivers, and physicians or pharmacists. Some rely on the Cannabis Regulatory Commission, like in New Jersey or in Michigan. And then 11 states and territories just leave it up to the healthcare provider. They think that cannabis might have therapeutic effects for a patient, then they can qualify a person, regardless of whatever the kind of enumerated list of conditions is. Recommendation 3 is kind of an oddball one, but the committee at the time was really evaluating vaping and vaping devices in the tobacco context, and they there was some concern about cannabis or vaping devices in the cannabis context. So I didn't want to do anything in rule right away, because it's really hard to evaluate what the impacts are or whether they would drive people towards, other sources of vaping devices. So, but I think that we have kind of identified some problems and think that we should look into limits on certain materials and then limits on temperature controls. So here's the problem. We heard from Health Canada, but California and New York have independently kind of pulled products off the shelves or gotten them from the illicit market and tested them. And they found, almost to a T, the presence of heavy metals above generally accepted tolerance limits in all of the products that they were testing. They did note, at least in this Canadian study from Health Canada, that the heavy metal concentrations were significantly higher in the illicit market vaping cartridges. Another, kind of unique problem about cannabis vaping devices is that they require higher temperatures to aerosolize Delta-9 THC as compared to tobacco or nicotine vapes. And that may contribute to component decomposition and leaching. And that was supported by the kind of 3 studies above. And then the two of the three, and then one more here. And then, I also called our kind of solid waste expert at the Department of Environmental Conservation, and they mentioned that they're actually looking at vaping devices more broadly to be in compliance with the state battery stewardship program. I've got a kind of link to the statute here, or a citation to the statute. They really kind of would like batteries to be easily removable in vaping devices so that they don't get kind of dumped into the landfill, the kind of lithium ion batteries getting ground up or dumped into the landfill. So the recommendation here again is to just consider the implications of these things at this point, not go full on and just put them into rule, but limit certain materials and heavy metals. I mean, most notably, there's lead, cadmium, nickel. I think copper are the ones that some states have just banned from being in the devices. I think 2 states have set maximum heat and voltage limits on cannabis vaping devices. I think cannabis vaporizes at 430 degrees Fahrenheit. So a lot of states just say, or 2 states have said, these things can't go above 500 degrees. They have to automatically shut off after that. And then require electronic cannabis delivery systems to be manufactured according to good manufacturing practices or requirements for medical devices. So all of them would be medical grade here. I just don't know what the impact. I don't know how many of the current cannabis delivery devices are medical grade. I don't know how many of them contain these heavy metals. So figure we might as well look into that before we do anything. And then the kind of secondary recommendation is ANR is required to do a battery assessment for all products, but including vapes. And just kind of take whatever advice. I think it's due next year, but I think they want to ask for an extension. So just follow whatever advice that they have with respect to and what kind of batteries can go in these devices. And then this has 3 attachments. The first is kind of explaining what Canify is, how it works, how it could be how it's been incorporated into other jurisdictions, and how it could be incorporated into Vermont. 2 of the 3 other named stakeholders, I guess 3 of the 4 actually included comments. Green Mountain Patients Alliance, Cannabis Retailers Association of Vermont, and the Medical Society. So this report, I think, is up on our website, or should be. Anyone should feel free to kind of dig into all of this. Nothing in this report obligates the legislature to do anything. So we'll see what comes of it. And that's it.
Thank you.
Anything else that we need to talk about?
Not today.
All right. I will adjourn the meeting. Thanks everyone who stuck with us throughout
Happy
that whole thing.
Thanksgiving.
Thank you.